For our movie assignment, we did the movie Fight Club presented by Avery Doyle.
And Brianna Lamont. To start us off, our star, the narrator, grew up without a father. He works for a well known car manufacturer to help determine whether or not their vehicles needed to be recalled. He continues to grow more and more tired of his mundane life and acquires an addiction for IKEA shopping and later attending various support groups to feel more alive. He forms a somewhat unusual friendship with a woman named Marla and later Tyler Durden, with whom he began Fight Club and which evolved into Project Mayhem.
The physical setting of the movie mainly includes bars, abandoned buildings, and desolate outdoor spaces, which fed into the insanity and unstable nature of the plot. The odd and somewhat sinister setting of this movie helped to draw the audience's attention to the character, magnifying the changes taking place within the narrator, as well as his unusual relationship with Tyler. The culture of the movie is shown through the main character as he takes control of his life, building a cult like following to achieve the goals he creates. The movie was about the main character's life as he struggles to come to terms with living in mediocrity and moving through the motions, truly blowing up his previous life as he seeks change. The main character has dissociative identity disorder, also known as DID. Our main character who struggles with this is dismissed by a doctor as someone who simply struggles with insomnia or poor behavioral choices that can be fixed without medical assistance. The other characters lacked knowledge of this disorder and were also unaware of the changeovers that were taking place between Tyler and our narrator. This negatively impacted him as it led to much unnecessary and unwarranted violence, with the resolution of the film resulting in terrorist attack levels of destruction. Globally, this disorder is commonly misdiagnosed with borderline personality disorder because there are similar symptoms, and most of the time, not enough psychological assessments are done to distinguish the two. Stigmas often associated with DID are that these people are violent and psychotic, which is also portrayed in the movie.
Some of the most obvious symptoms that the narrator experiences include insomnia and what appears to be depression, which he has experienced since the beginning of the film, as well as hallucinations, suicidal tendencies, and the presence of a second personality, Tyler Durden. These are obvious when we see him fighting Tyler in some of the final scenes of the film, shooting a hallucination, throwing himself downstairs, and shooting himself to shut out the destructive nature of Tyler's personality. The narrator does not appear to experience any kind of eating disorder or panic attacks through the movie, which are symptoms of DID. There are a few directions that could be taken to treat a person diagnosed with DID. Since DID is often triggered by the presence of severe childhood trauma, psychotherapy is a good place to start in order to process painful memories, manage sudden changes in behavior, and bring the multiple identities back into one person. Our recommendation is a combination of cognitive behavioral therapy in order to help better base his thoughts in reality and help to cope with his depression, and schema therapy to help with the healing of negative schemas that have occurred as well as gain control of possible triggers and remove the power from previous trauma. We also recommend that he get on antipsychotic medications to help him gain back a better sense of reality, possibly in combination with antidepressants or anti anxiety medications to help decrease his other symptoms. While there is no set cure for the disorder, integration is possible. There are still risks for future creation of alters or continued dissociation. Some of the biggest concerns that are present for treating DID is that not all psychologists are in agreement that the condition exists, as it can be hard to tell when people are lying. Or another common event may be that patients are dismissed with an incorrect diagnosis, causing greater patient distress, such as in the movie.
Overall, I believe that the movie portrayed the psychological aspect of this disorder somewhat accurately by representing the alter ego as the main decider for majority of the movie, which made the narrator feel like a bystander in his own life. However, the movie portrayed people who struggle with this disorder as someone who is violent, dangerous, and a destructive person, which isn't always true. It also doesn't necessarily address the trauma that causes this disorder, besides possibly mentioning that the narrator doesn't grow up with a dad. There is a new understanding of this disorder in the film because we saw how the narrator did not realize this alter ego was imaginary until the last bit of the movie. In some ways, this proves how we should have empathy towards people with DID since they may not be their true selves at times.